Hello. We'll start to set of lectures about care of the patient, and first topic of our today's lecture is basic principles of the public health structure and organization of the work of the admission and therapeutic departments, care of the patient and its meaning. First of all, we'll stop on the main components of the health care. And first of all, it is medical prophylactic helps because the first aid of any medical personnel to prevent development of the disease, because easy prevent disease then treat and stop it in the development. And all medical personnel must have some knowledge which helps to prevent as possible development and spreading of some disease. Next component is provision of sanitary hygienic well-being, because some pathology appears due to bad sanitary hygienic rules, and every patient, every people must be informed about definite sanitary hygienic rules. And first of all, this knowledge helps prevent formation of some infectious and virus and bacterial diseases. And last component is health promotion, because we must inform our people about some knowledge which help hold his health as possible longer and prolong time of his life. The basic principles of health care practice may be divided on two groups: prophylactic and human rights in health. If we are talking about prophylactic, we distinguished three types of prophylactic. Primary prophylactic indicates measures which helps prevent formation of disease. It's more significant direction of our health care practice, because I said you easy prevent disease than treat it. We distinguish secondary prophylactic measures which are used for the patient with some chronic disease and helps prevent the exacerbation. Other words, helps prolong period of stabilization of disease, and also helps prolong life of patient. And tertiary prophylactic measures is needed in situation when the all preceded prophylactic measures not effective, and will pay our attention on prevention of complication of any chronic disease. If we are talking about human rights in health, we must be informed, and our patient also, about some medical service which may be paid or may be free, depending of medical policy. Patient and doctor must be rated in some rules of treatment. First of all, doctor must have full knowledge about indication and contraindication and some complication of medicines, and patient also must be informed about positive and negative effect of some treatment. And all this knowledge must be held in special document. Main document of the doctor is case report, where is hold all information about patient. We can find information about disease, about plan of examination, result of some laboratory and instrumental examination, and order of treatment. And this document indicates about true or false action of doctors. I want to stop on some types of medical institution which divided on some groups. We distinguished medical prophylactic institution, sanitation prophylactic institution, forensic medicine, and pharmaceutical and medical equipment. Pharmaceutical and medical equipment includes pharmacies and stores of medical equipment. Forensic medicine is a bureau of forensic medical expertise which actively used for clearance of some disease and any expertise which are needed for living patient. Sanitation prophylactic institutions include sanitary epidemiological station and centers, institutes for health education, which study and provide some sanitary hygienic methods which helps prevent formation and spreading of some disease, and first of all infectious diseases. Medical prophylactic institutions divided also on some groups, and first of all we distinguish outpatient clinic. There are polyclinic which are independent medical prophylactic facility. Polyclinic has some laboratory and diagnostic services. Physicians of all specialties receive patients at the polyclinic. Ambulatory is a small part of the polyclinic which may be found in a small village or small towns. There may be one doctor and medium medical personnel. 8 posts may be on some factory or in some statement if needed. Outpatient clinics are female consultation and emergency aid station. Emergency aid station provide medical aid in critical cases and accidents. The stations are open to the patient 24 hours per day. Inpatient clinic divided on 2 groups, hospital and clinic. Hospital is an institution for accommodation patient and supervising the treatment. It has admission, medical and administrative department. In clinic, patient must be under attention of medical personnel whole time, and you understand in clinic may be treated groups of patients which are unable to take treatment at home. We said about outpatient medical prophylactic institutions because the condition needed whole day control of medical personnel. Clinic is a medical institution where patients receive medical attention also in stationary conditions. But on contrary from hospital, medical students are educated at clinic. Clinic are also centers of medical research. Dispensaries. There are specialized hospitals. Usually we distinguish tuberculosis, infectious dermatological dispensaries, which give only specialized aid for the patient. Medical emergency institution usually give surgery treatment for the patient after some emergency situation. Institutions of maternity and childhood, widely used in some countries because they give full aid for the woman and the child. And sanatorium and spa institutions are the stationary medical institutions where an environment is provided for the sick to recover completely from the illness. As a rule, sanatoria are located in areas with a good climate where mineral water and therapeutic moods are available. Medical health types divided on some steps. First of all, we distinguish first aid, which may be given any peoples without special medical education. For example, easy trauma, immediate evacuation of the patient may be given any peoples which presented nearest. Pre-medical aid may be given medium medical personnel, nurse, which has primary medical education. This group of the medical personnel can measure blood pressure, measure body temperature, count respiratory and cardiac rate, and give pre-medical aid in some acute situation. First medical aid may be given only physician with general specialization. Usually there are therapeutic physician which works in polyclinic, in ambulance and in emergency aid station, which can reveal primary pathology and give necessary primary treatment. Qualified medical aid may be given in some special institutions. There are cardiovascular, dermatovenerological, some ocular, some laryngological situation which needed definite specialization. And high type of medical help is specialized medical aid. There are institutions which do transplantation or some other more high level medical aid. When we are talking about medical institutions and working activity of some medical personnel, we must remember about some ethics and deontological principles. Ethica, study of morality, said ancient Greek philosopher Aristotle. Deontology, the doctrine of duty, said English philosopher Bentham. Now we'll combine both these principles because they tightly correlated and widely used in our practice. And first of all, I pay your attention. Ethic and deontologic includes first of all, doctors' actions and some morality duty and the behavior. First of all, you know that Dr. Smoke has white color because it is wishes of doctor which must be clean. Deontology may be defined as the set of rules and principles of medical ethics which governs a member of the medical profession in the exercise of his professional duties. The deontological principles should be followed by all medical workers. The main object of deontology is the relations between doctor and patient, between the nurse and patient, and also between the physician, nurse, and patient. Positive relation between the patient and assistant physician or the midwife may accelerate recovery. The careful attitude of the physician, his assistant, or a nurse towards the patient is mandatory for a normal atmosphere in a hospital or any other medical establishment. The main deontological requirement is high medical skill and a constant drive to improve one's knowledge and skills. 3 weapons have a doctor: a word, a plant, and a knife. And we must remember main high principles which was provided by Hippocrates: primum non nocere. If we cannot completely help the patient, we will never aggravate his condition. Biomedical ethics, first of all, includes relationship between the medical staff and patient. While we must remember, while discussing the case with his colleagues at the patient bedside, the physician should avoid words and terms that might be unknown to the patient or might be misunderstood by him. An occasional thoughtless word from the physician may impair the mood of the patient, impair his sleep, appetite, and general condition, and even may provoke disease, which will be called iatrogenic illness, diseases which appears into the hospital due to not right action of medical personnel. We must remember about medical secrets. All knowledge of physician about patient should be kept because the patient is open for the doctor. It is needed for clearness of disease and correct treatment. But we must hold this information from any side. But we must remember some diseases needed other action. For example, if the disease is infectious, the patient should be hospitalized because his isolation arrests the spreading of the disease and provide better condition for treatment. And sometimes this information must be needed for patient surrounding, for member of his family, for example. We must hold information about reproductive technologies because they have some problems of genetic engineering and must be held and also included in medical secrets. All these actions regulated with medical law, which we must go depending on our blocks. If we are talking about ethics, what to understand about ethics? Ethics, the science of morals, rules, and requirements for social conduct. Medical ethics implies the morals of medical workers, their attitudes toward each other and toward their patient. We must remember about some problem as medical error. It may be due to impossible complete examination of patient when will be established false disease. More grave, its medical error appears due to low knowledge of doctor or other medical personnel. But in any case, if a physician discovers an error in the prescriptions and methods of his predecessor, he must correct it factful so that the patient does not lose his faith in medicines and in the recovery. More grave, medical crime due to non-adequate attention or very low knowledge of medical personnel. Medical crime will be decided with special medical law, and it may be grave for the patient because may provoke sometimes death of patient. For example, if the nurse introduce false medicines, or if the doctor cannot give his treatment and some examination in time because he decided, first of all, I drink coffee, I needed some rest, and then can I go to the patient because cannot adequately assess condition of patient and decide about time on definite aid. And we gradually go to next question of our today's lecture, care of the patient. In medicine, the concept care of the patient stands as an independent described line and represents a whole system of measures, including correct and well-timed performance of various prescriptions, carrying out of some diagnostic test, preparation for the certain research, overseeing the condition of the patient, giving the patient first aid, and conducting the necessary medical documentation. Quite often, the success of treatment and outcome of the disease are determined by the quality of care. Thus, the care of the patient, obligatory component of all treatment process. And first of all, care of the patient will be made of nurse and nurse assistant because they more long time presented near the patient. Principles and order care of the patient was regulated from 1987 year when will be formatted first World Health Organization. Then they will be developed, and in medieval period they include some spiritual knightly order of Lazarus, for example. 17th century will be formed a relief society which regulate process care of the patient. In our country, first Russian community of Sisters of Mercy was formed in 1844 year in St. Petersburg and then developed during Crimea War during 1853-1856 years and provided by our Russian physician Pirogov. Same time, conception of nursing offered by Florence Nightingale, which provide first set of rules of nursing actions. And I'll again remember you, care and treatment tightly connected. Cannot be effective treatment without definite care. We distinguished two types of the care of the patient, but in any case, it must be made with any member near the patient, his family, and all medical personnel. We distinguished general and specific care. General care implies carrying out medical and prophylactic procedures irrespective of the character of the particular pathology. Other words, these measures may be used for any patient not depending from his disease. And special care requires carrying out procedures that are specific for a given disease, pulmonological, otolaryngological, and other order. If you see on this grave patient, first of all, he needed general care because he unable to help himself. This patient, we see special care because we'll help the patient with some pathology of the nose and throat with sometimes needed definite practical skills. Next question on which we stop today, there are organization of the admission and therapeutic department work. And first of all, we'll stop on organization of admission department because every clinic and hospital start from admission departments. Patient enters in hospital. Some very good when he is separate, but more often some groups of patients independently needed some doctor's help and needed to wait sometimes in corridor. There must be specific seating for the patient. In every admission department must be permitted for the doctor and nurse work. Because every patient must be registered, there are action of nurse, which post may be into the corridor or in special room. Then patient obligatory will be examined of doctor, and only doctor can assess condition of patient and decide questions about necessity of his hospitalization or emergency aid or any other manipulations. If the doctor has some problems in establish of disease and cannot immediately decide what aid first of all needed for the patient, because maybe some combined diseases, patient can be held in admission department where presented some diagnostic work. And during 1 day, 24 hours, patient must be completely examined with some laboratory and instrumental method. And questions about his hospitalization must be completely decided. Usually, this situation appears during night period when in hospital may be only one duty doctor. And without specific specialized knowledge, he cannot completely decide question about order of treatment. And patient can wait morning when doctors from all departments of this hospital go to the work and can additionally examine patient and decide question about his next treatment. In admission department, obligatory must be sanitary hygiene block, especially for the patient, which will be hold some time. Must be procedural room because some patient needed emergency aid. For example, patient with high blood pressure, patient with bleeding, patient with high fever. Or after some manipulation, patient can be discharged and continue his treatment in polyclinic under control of polyclinic ambulance doctor. Must be nurse and doctor's room when medical personnel can rest some time and can work in specific environment. There are main structural elements of admission department. Let's see order with which patient go into the hospital. Patient enters in hospital. We distinguish three ways with which patient can enter in hospital. According to plan, it's more often way because patient hospitalized due to direction of polyclinic or ambulance or emergency aid doctor with definite diseases and with definite aim. For example, for full examination which impossible in ambulance condition. For treatment which also cannot be completely given in ambulance condition. It's more often way hospitalization according to plan with direction from polyclinic or ambulance doctor. By the emergency, this more heavy because patient sometimes enters without clear disease because some situation needed special examination, but doctor of emergency aid assess condition of patient and decide that his condition is grave and needed acute aid which cannot be completely given in home or ambulance position. This patient emergency hospitalized and doctor of hospital, doctor of admission department, duty doctor decide question about next order of treatment. And last way is independently. When the patient enters in hospital without any direction. For example, some men go to the work with good condition. But after some time he feels giddiness, weakness. See, he stands near his hospital. He decided he needed doctor's aid and immediately go to the hospital independently because no any direction from medical personnel. And again, duty doctor of admission department will decide question about the situation. If patient needed emergency aid and hospital treatment and examination, he will be hospitalized. If no, after some aid, he with some direction can go in polyclinic to his ambulance doctor. Now let's see way of the patient into the admission department. If you remember, I said you every patient which enters in hospital must be registered in special register. Then patient will be examined by doctor which decide question about next his action. If his condition not grave, nearly satisfactory, patient may be refused with some direction to next treatment or examination. If patient needed to continue treatment in hospital, he will be hospitalized. And first of all, this question is actual for the patient which enters in hospital by emergency aid or independently. Then, if the patient hospitalized, he will be examined with nurse. And first of all, we must do examination on pediculosis because patient will be nearest other patient, and first of all, we must prevent spreading of some parasite into the hospitals. Then, nurse will do anthropometric and other manipulation, first of all, measurement body temperature, which helps completely assess condition of the patient. After that, patient must be made with some hygienic manipulation, after which he will be transported in any department. If you see on this slide, you can see that it's colored with three colors. A red color indicates action of doctor, examination of the patient, deciding question about hospitalization and treatment, and transportation in any department. There are action of doctor. Registration, examination on parasite, anthropometric and measurement of body temperature. There are nurse manipulation, medium medical personnel, and hygienic and transportation manipulation are action of nurse assistants, groups of the medical personnel without specific medical knowledge. But I'll again remember you. Main medical personnel which answers on all questions and regulate actions into the any medical department is doctor. He will answer on himself action and action of all medical personnel. Why? We'll start to study with you duties of the medical personnel, first of all from younger medical personnel, nurse assistant, then nurse, and then doctor's manipulation. Registration. We remember it is action of nurse, medium medical personnel with definite medical knowledge. Every patient registered in special chart where will be shown patient hospitalized or discharged. If patient hospitalized, additionally will be spelled case report. I said you that it is main document of the doctor where showing all doctor's opinion and manipulation. And fourth page will be show with information about inspection of the patient on pediculosis, general information about the patient, and sometimes maybe show with primary disease. Patient examined on pediculosis. I want that you remember lice are carrier, typhoid, and relapsing fever, grave infectious diseases. They very easy spread from one to other people. And when the patient enters in any station, first of all, we must know that he is free from pediculosis. From biology, you remember pediculosis divided on three groups depending the location: pediculosis capitis, pediculosis pubis, and cloth line. And I especially show you photo of all line that you can remember. All these lines have different structure, and pediculosis capitis cannot live in any other sites of the body due to their specific structure, such as pediculosis pubis and cloth line. And we distinguish specific parasites, scabies, which are invisible and may be revealed only with special microscopic examination. Now, let's stop on every parasite. Pediculosis capitis localizes on the head of the patient, and nurse first of all examine head of the patient, and especially pay attention on the skin near the ear and forehead. How can you know about possible presented pediculosis capitis? Due to specific behavior of the patient, because patient feels itching, because lice first of all bite the patient, because the eating is our blood, and as a result patient feels itching. What will you find on the head of the patient? We can see lice, we can see the eggs, small white eggs which hold on the hair, and we can see rashes of the skin due to itching. What will you do? We must remove lice. With this purpose, we'll use different medicines which will be put on the hair of the patient and hold sometimes depending of medicines. After that, head of the patient must be showered with soap, shampoo, and brushed to remove all died lice and their eggs. Sometimes this manipulation must be repeated, and during this time patient must be hospitalized in separate individual room to prevent spreading of lice to other patients. Pediculosis pubis crab lice has other structure, and they localizes on pubic area, on the areas of armpit. Sometimes when they severe spread, we can find pediculosis pubis on the eyelids and brows of the patient. What will you do in this situation? Also, we can put special medicines, and all hair in pubic region in armpit must be shaved off obligatory. And then again showering of the patient with soap and shampoo. Cloth lice may be found only on the cloth of the patient, especially in the plate of the cloth. But they needed some food, which is our blood. And they obligatory periodically go on the skin of the patient, bite them. And again we see scratches on the skin because patient feels severe skin itching. What will you do in this case? All clothes must be removed and utilized. Patient go to the bath and shower. And last parasite, microscopic parasites, scabies, which are invisible because it lives under the skin. How can be found? He lives on the very thin skin, usually on the hand and between the finger and on the abdominal part. No, in grave cases, they spread along whole body. What are signs presented of scabies? On the skin, we see specific double dots, opening through which scabies go under the skin and go out again. Go in, go out. Double red spot, which provoke severe skin itching, and as a result, skin of the patient covers with scratches. You see scratches on the skin. This parasite needed special long treatment. We put some ointment or some liquid solutions, liquid medicines on the body, which helps to remove this parasite. No, you see patient without some home, patient from the street, where we can see all types of lice, yeah, capitis, pubic, and cloth lice. You see, no, you understand, cloth of the patient must be utilized, all hair covering shave off, and full bath for this patient with special medicine. Next, action, anthropometry. We'll measure height and weight of the patient with special height method. Depending condition of patient, we can measure height of patient in erect or in sitting position. Then with special medical balance, we'll measure his weight. And you know, height and weight of patient tightly correlated. If we are talking about height of the patient, from physiology, you will know that height of the patient regulated with some endocrine gland, and first of all, pituitary, thyroid, and sex gland. As a result, we'll distinguish two normal height for the males and females. If the height of the patient diminish, we are talking about dwarfishness, which is result hypofunction of the anterior lobe of pituitary. In this case, we are talking about nanism, because patient delayed only in physical development, his psychic development completely halt. If the cause of dwarfishness hyperfunction of thyroid gland, it's more grave, because together with physical development, patient delay in psychic development. We are talking about cretinism. This patient unable to live independently. Opposite condition, height of the patient increases, exceed 2 meters, 200 centimeters. We are talking about gigantism, which is caused by dysfunction of anterior lobe of the pituitary or some problem with sex gland. Next slide demonstrates you normal patient, patient with gigantism and dwarfishness, patient with nanism and cretinism. Weight of the patient, I said you tightly correlated with height of the patient. We distinguish normal, insufficient, in grave case which is called cachexia, or increased, or obesity. How can you know about norm or pathology? For this purpose, we'll use different indices. More widely, we'll use indices body weight, which counted when we'll divide weight of the patient in kilogram on his height in meter second degree. Normally, it varied from 18.5 to 25. If less, we are talking about insufficient. If more, increased, and from 30, we are talking about definite degree of obesity, which needed specific medicine correction. Approximately, we can correlate our height and weight when we'll from height minus 100. For example, for the patient with height 180 centimeters, normal weight will be nearest 80 kilogram. If less, insufficient. If high, increase. Sometimes we'll measure other sides of the body, and head circumference widely used in pediatric clinic, especially in newborn. Chest circumference sometimes measured in pulmonological department. Waist circumference widely used for diagnosis of obesity, and decided question about correction of the weight of the patient to prevent acute cardiovascular situation. And we must know normal waist of the males deviates from 94 to 102 centimeters. For females, 80 to 88 centimeters. And if the waist circumference increased this level, it may be grave provoke fractures, acute cardiovascular situations such as myocardial infarction and brain stroke, and will pay attention of the patient on the definite level of this index. Patient primary examined, and before transportation in definite department, he go through some hygienic manipulation, which may be as bath or shower. We distinguished complete or partial hygienic manipulation, which depended from condition of the patient. If possible, we can use complete. If condition of patient grave, hygienic manipulation may be restricted. No, for example, patient after trauma which needed emergency surgery correction. We haven't time to complete hygienic manipulation, and condition of patient is contraindicated for this manipulation. We'll use portional manipulation if needed, and patient immediately enters in surgery department. But if the patient will do hygienic manipulation, we must remember and about some hygienic indices. Surrounding air must be near 25 degree Celsius degree. Water from 34 to 36 Celsius degree, which correlated with body temperature, and time of manipulation nearly 15-30 minutes. Patient primary examined with primary diseases. Patient clean, then he may be transported in definite department. I want you remember and name some more often hygienic but contraindication. Patient with cachexy, only portional manipulation. Patient with some acute diseases such as myocardial infarction, brain stroke, hypertensive crisis, acute cardiac or vascular insufficiency. Patient with active tuberculosis, unable to do complete hygienic manipulation. Some skin diseases and bleeding also contraindicated for hygienic bath. Only portional or some shower manipulation. Transportation of the patient. Patient may be transported to definite department on foot if his condition is satisfactory, on armchair, wheelchair, if he unable to go independently. No, for example, some trauma of lower extremities, patient with elderly period, a patient weak with high fever, with high pressure, to prevent any complication. Patient may be transported on stretcher cart in lying position. There are groups of patients which are unconscious. Patients with some acute diseases such as myocardial infarction, brain stroke, severe trauma, bleeding, acute abdomen. And in some small hospital on hands, because no stretcher cards or it's impossible to use in definite situation. Which is way of transportation: foot, armchair, stretcher card, and on hands. Let's see how it will be made. If we'll transport the patient on stretcher, when we go along the tray, you must remember, in any case, not depending of our direction, head of the patient must be upward. If we transport patient on stretcher cart, I'll pay attention on the replacement of the patient from stretcher cart to the bed. Stretcher cart may be placed horizontal, parallel of the bed. In this case, it easy moves from the stretcher to the bed. Sometimes stretcher may be placed perpendicular of the bed. In this case, we'll put opposite side of the stretcher to the side of the bed. For example, leg side to the pillow side of the bed, or pillow side of the stretcher to leg side of the bed. It is needed to easily replace patient from stretcher to the bed without any additional roll movement. Because we remember, on the stretcher will be transported only heavy patient with severe heavy diseases. You see other transportation of the patient on hand when the stretcher or wheelchair are absent or impossible to use. It is information about structure and action of admission department. Patient enters in definite department and first of all will stop on organization of the therapeutic department work. In therapeutic department, presented manager of department which regulate and control action of all medical personnel. Physicians which give the aid of patient, determine order of treatment and examination. There are high medical personnel after medical university with high medical knowledge. Medium medical personnel, senior nurse, which control action of all other nurse, ward and procedural nurse. Medium medical personnel with primary medical knowledge. And younger medical personnel without any specific medical education. First of all, senior nurse assistant, which answers on the medical equipment and patient and bed equipment and control work of the other nurse assistant. Maybe general nurse assistant or maybe specialized nurse assistants which may do only definite manipulation. It depends from the size of hospital and size of department. We know medical personnel which work in therapeutic department. Let's see structure of therapeutic department. First of all, must be premises for medical personnel. Doctor's room, nurse assistant rooms. Then, nurse post. Usually, it must be placed such that nurse easy see all ward and the patient and can immediately go to the patient if needed. Obligatory procedural room where will work procedural nurse and will be made some injection and we can take blood for some laboratory examination. Patient premises, first of all, what? We divide it on 3 groups. 60% of the ward includes 4, sometimes 5, 6 beds. There are wards for the patient with moderate, heavy or some satisfactory condition which needed sometimes for doctor's control. 40% of the ward divided on small ward, 20% for 2 beds and 20% for 1 bed. 2 beds for the heavy patient, for senile patient, which must be restricted from any nurse. And 20% very small separate room. No, usually this ward needed for the grave patient, for patient which may die anytime, to hold other patient from negative information. And sanitary hygiene block. Each is structural elements of therapeutic department. Let's stop on duties of the medical personnel. No, we said doctors control all process into the department and first of all treatment and examining process. Nurse, we said chief nurse in large hospital which control actions of all medium medical personnel, and in every department presented senior nurse which control action only department nurse and control medicines and other medical equipment. ward nurse, first of all, will do all doctor's prescription. And procedural nurse, which will do some injection and take blood for some laboratory examination. In surgery department may be operated nurse. In some large department may be community nurse and dietary medical nurse, which may be in different department or maybe in whole hospital. It's dependent from size of the hospital and department. Community nurse decide all questions which appear during treatment. No, you understand her action tightly connected with deontological ethic principle. Dietary medical nurse control nutrition of the patient, prepare specific dietary directions for every patient and for every department. Let's stop on the duties of ward nurse. His active site is nurse post. I said you, it must be placed such that nurse easy see every patient and easy can go to him. What are main duties of post or ward nurse? No, first of all, he controls condition of the patient, can measure body temperature, blood pressure, count cardiac and respiratory rate, and assess his behavior. She will do all doctor's prescription, give some medicines, and if needed can do some injections in time when procedural not absent, because nurse post will work during whole time. Procedural nurse usually works during daily period, but evening injection will be made with post nurse. On the post obligatory must be, you see now, computer to do any documentation, because very more different documents will be do with nurse, ward nurse. First of all, it is movements of the patient, because he controls how patient presented, what patient discharged from hospital, how many free bed presented in hospital for next hospitalization. Obligatory box where will be hold medicines, maybe refrigerated, because some medicine needed special rules for keeping. And nearest nurse post may be small procedural room, because it is needed specific sterile condition where may be made some injection. We see action of post nurse. First of all, control condition of the patient. Then working with some documentation. Measuring body temperature and blood pressure. All types of injection. Taking blood for laboratory examination. Feeding of patient and medication. All these actions are duties of the post nurse. Procedural room. I said you needed special sterile condition, because injections there are small surgery manipulation. During daily period in procedural nurse will work procedural nurse, which will do all types of injection, intramuscular, intravenous, drop-like injection, and she can take blood for any laboratory examination. Obligatory also boxes for the medicine, usually closed with glass, because some manipulation must be made very, very fast in acute situation. For example, patient falls consciousness, any acute allergic reaction, attacks of dyspnea. All medicine must be separated on some groups and obligatory refrigerated, because procedural nurse works with blood. Duties of junior medical staff. Other words, medical personnel without any specific medical education. Also, first of all, senior nurse assistant, which control action of all nurse assistants, and she answers on the keeping of some equipment, bed linen, body linen, enemas and any some equipment which needed for some manipulation depending of department. Nurse assistant. First of all, regular do wet cleansing of the premises. I said you may be general nurse assistant which may do any manipulation, or maybe separate nurse assistant which will do only definite manipulation. For example, only wet cleaning of ward, only separate for procedural room, separate for hygienic block. Nurse assistant assists nurse in patient care, about which we'll say slightly later. Sanitary hygiene treatment of the patient. Give bedpan, remove bedpan, clean the patient, bath, shower. There are all manipulation of the nurse assistant. Escort patient for diagnostic and therapeutic procedures. Also maybe general action or maybe separate, not only for escort of patient. And transportation of the patient into the department, from one to other department, and in case of death, also each section of younger medical personnel. Let's stop on some general care of the patient manipulation. I remember there are action of all medical personnel, but first of all there are action of nurse assistant and nurse. What included in general care of the patient? No, first of all, you understand it is needed for weak patient, for senile patient, for unconscious patient. Other word, patient who is unable to help himself independently. And every morning will start from the general care of the patient. And it must be made with definite order. And first of all, we'll start from eye care. Every morning, nurse or nurse assistant put gloves. Eye care needed some sterile condition and prepare some equipment. I pay your attention. Every manipulation will be started from preparing of equipment. Then you name indication or contraindication for this manipulation, and then demonstrate order of this manipulation. Because during practical classes you will study all this manipulation, and some manipulation will be included in control point to assess your knowledge. Same order for summer practice. For eye care, time manipulation every morning. What we are needed? We needed oil cloth, which must be placed under the patient, kidney-shaped basin. We must take sterile gauze balls and some solution. It may be usual warm boiled water, sometimes needed specific medicine, for example 3% boric acid if the patient has some problem with eyes and it was prescribed by doctor. Maybe special container for solution which may be easy used of the medical personnel and sometimes independently of patient. Let's see order of manipulation. First of all, we'll put oilcloth or kidney-shaped basin under the eyes of patient and can put some water and clean eyes with gauze napkin. Or we can put some special container which patient can use independently. For example, patient on strong bed regime, patient unable get up from the bed, but patient conscious and his hand completely active. Patient can clean his eyes independently. If needed some medication, we must remember in every eye we can put 1-2 drops of medicine which obligatory must be warm before optimal temperature 33-37 degrees, approximately nearest body temperature, because in other case patient immediately blink and all medicines will be removed. No effect of treatment. How correctly put medicine into the eye? We'll take sterile gauze napkin, slightly move lower eyelids downward, and with pipette or with special balloon, we'll put 1-2 drops of warm medicines on the lower eyelids of patient. As the patient closes the eyes and with gauze napkin removes excessive medicines. If we needed put some ointment, same order. With sterile gauze napkin, we'll move lower eyelids downward and put medicine from inner to outer edge of the eyes. Patient close the eyes, will remove excessive medicine with gauze napkin. Ear care. Ear care will be made in morning, but on contrary from white 1-2 times per week. Not needed every day. For this manipulation, we needed special cotton swabs. And we must remember anatomy of ear. We can clean outer and inner ear canal, but prevent any trauma. For this purpose, we'll move ear of the patient slightly up and backward. That ear canal will be straight as possible. Then we carefully, with rounded movements, inside sterile cotton swabs. It's more optimal. It's not obligatory, but more optimal to prevent spreading of some bacterial infection. Hand of the nurse must be clean and with cloth. If needed, put some medicines. On contrary from eyes, into the ears we can put 4-6 drops of medicine, but they also must be warm nearest body temperature, which may be comfortable for the patient. We move the hand of the patient on one side, slightly moves ears of the patient backward and upward, and put some drops of medicine. Then obligatory close the ear canal with sterile cotton wool to prevent removing of the drops from the ear. If needed next ear also, will repeat manipulation. Nose care must be made every morning. No, I'll remember you, nurse works with cloth. Will again take special cotton swabs, maybe clean or sterile. Remember anatomy of the nose canal. Patient slightly move hand what, and will carefully with rounded movement remove specimens from the nose canal. Sometimes may be needed some balloon to remove all mucus from the nose, patient with inflammation of the nose. Sometimes we must moist the nasal canal with some oil. After that, we can remove some corks. If needed, put some medicine into the nose. We can put 3-4 drops of medicine in every canal patient. Slightly move hand backward, not significantly, because we must hold medicine into the nose, but not into the throat. Mouth care. Mouth care will be made oftenly, because morning and after every meal. If patient able, we can give him tooth and toothbrush and kidney shape basin, water, and patient can clean his tooth into the bed. If patient unable, we must help him. For this patient, we'll take oilcloth, which must be placed under the head of the patient, kidney shape basin, goes water, some solution. It may be warm boiled water, it may be baking soda, it may be 3% boric acid, all which was prescribed by doctor. Sometimes needed bite block, especially for the unconscious patient. And sometimes needed moisturizing agent on the lips. If the lips of the patient very dry, to prevent the trauma after manipulation, we must use water-soluble lubricant or lip balm. Our patient unconscious, to clean his oral cavity, first of all, we'll move the hand of the patient on side, put under his hand oilcloth and kidney shape basin, and then with special equipment, we can clean his mouth, or we can put gauze napkin on the finger and carefully clean the oral cavity to remove excessive mucus, to moisten the oral cavity, and then lubricate lips of the patient. Sometimes needed use specific bite block that the mouth of the patient will be open some time, because if the patient unconscious, he cannot control his actions. Hair care. One per week must be clean. And we'll use 3 main manipulations: shampooing, combing, and brushing. For this manipulation, we'll take oil, cloth, special basin, which may be rubber or plastic. We can use basin with water, deeper, warm water, shampoo or soap, towel, and comb. We'll put on the bed of the patient oilcloth, on which we can put special basin, more often if it is rubber, because it's more comfortable for the patient. We can move ahead the end of the functional bed if it's possible. Put the hair of the patient under the basin and shampooing with warm water and shampoo or soap. After that, we'll dry and brush hair. Skincare. Needed every day, but full skin care we will do 1 per week. It will be bathing the patient, which patient unable go independently in bath or shower room. Again, first of all, we put oil cloth under the patient. We must have special basin with warm water and towel. We'll start clean the skin from up to down continuously. First of all, face of the patient, then his trunk, chest and abdomen and back of the patient, then extremities, upper and lower extremities. For this purpose, we can put basin with water under the leg. If needed, we can shave off nails of the patient, put some ointment, but obligatory skin after bathing must be dry. And when we are talking about skin care, I want to pay your attention on specific problem, formation of skin breakdown, which are formed due to abnormal blood circulation, especially on the side of the body which has very thin subcutaneous fat tissue or without and side which are used more intensive pressure. Now, for example, if the patient lies on the back, will more attention paid on the scapula and spinal cord and elbow region and soleus region. If the patient sleep on the front, will pay attention on iliac bone, knee and tibia. Areas which poor with subcutaneous fat tissue and skin vessels very easy compressed due to pressure of body. If the vessel compressed, blood circulation stop and nutrition of tissue stop. You understand, if this process long-standing, tissue died. How can you know about formation of skin breakdown? First of all, skin becomes pale due to upset blood circulation, then he becomes hyperemic, and finally, if our measures not effective or our care not effective, we can see formation of trophic ulcer, skin breakdown. What will you do? What is prophylaxis measures which are obligatory for every patient which can unable to help himself, which holds on strong bed regimen and especially unconscious patient? First of all, we must control bed and body linen. They must be without any link. Then we'll use special bed or special mattresses or rubber cycles of which prevent pressure on the vessels, and will change position of this equipment, will put under the definite side of the body to prevent compression of vessels and stop blood circulation. Then obligatory will change position of the patient 8-10 times per day, one side, other side, on the back, on front and other. And every day 2-3 times per day will wipe skin with some alcohol solution, because they do skin more hot and prevent it easy compression under the body pressure. And last question on which I want to stop today is changing bed and body linen. It must be made 1 per week and as needed. No, for example, if patient after bleeding, after vomiting, after uncontrolled urination or defecation, we cannot wait 1 week. We'll change bed and body linen immediately. If our patient very weak and unable to get out from the bed, we can change bed linen to they. If the patient can sit, we sit him, and first of all, rolled clean linen we'll put under unrolled loin linen. If the patient unable to sit, we can push him upward or can move him on side. And again, first of all, clean linen must be rolled, then if unrolled, loin linen will be gradually rolled. No, this manipulation you will do during practical classes. Body linen also must be changed one per week or as needed, especially for the weak patient which are unable to help himself. You see, first of all, we'll move body linen upward, then first of all move through the head and then through the extremity. When we'll take it, opposite order, first of all on extremity, then on head and downward. If our patient with trauma any extremities, first of all, we'll remove body linen from the health hand and then from affected to prevent the exit traumatization. If we'll take in opposite way, first of all on the affected and then on health hand. Our time finish. Thank you so much for your attention. All other manipulation you will study on practical classes. And we'll meet with you next week, same time, 9:50. Goodbye. Be healthy.